Hello everyone, in this video we are going to learn about homeopathic remedy and their indications in hemorrhage. In the first video we learned about arnica and haemorrhage in hemorrhage. In the second part we read about calcarea carb and camphora. In the third we dealt about phosphorus and ipecac. Here we'll be dealing about lachesis and crotalus. First we'll head on with lachesis. Ailments from wounds, post-mortem, suppression of quinine, bad effects of poison. Sphere of action: cardiovascular system, heart, kidney, nervous system, mind, skin, mucous membrane. Diathesis: hemorrhagic diathesis, which means people are prone to hemorrhage, that is bleeding. Thermals: hot patient. Lachesis is a hot patient. Lachesis decomposes the blood, making it more fluid and non-coagulable, resulting in hemorrhage. It acts on the blood, lachesis acts on the blood and make it more diluted, more fluid. Hence it will be non-coagulable and it results in hemorrhage. Inflammation, ecchymosis, gangrene, abscess, pyemia, jaundice. It leads to all these conditions. Small wounds will bleed easily and profusely. Same thing in creosote, haemorrhage, phosphorus, china. Bleeding with malignant and asthenic inflammation, gangrene and pyemic condition. Character of blood: dark, watery, offensive and non-coagulable. Headache: in drunkards with high BP, sensation as if blood has gone towards the head. Character of headache: congestive type of headache as if skull would burst. Menses in lachesis: along with menses there may be hemorrhoids, which is piles, headache. Menses are short and scanty at regular time. The time of menses will be regular, but it will be short for a short period of time and it will be scanty. Character of headache: so character of blood: blood is dark, watery and non-coagulable. Modality: all troubles are relieved by menstrual flow. Skin: hot hemorrhage with bloody sweat. On the skin there may be ulcers, gangrene, pyemic, asthenic inflammation from which continuous and profuse blood oozes along with other offensive and ichorous discharges. So the discharges will be corrosive, ichorous, corroding. Fever: hemorrhage from bowels during typhoid fever due to perforation of intestine. There is perforation of intestine which is leading to hemorrhage in the bowels and during the typhoid fever. Nose: nosebleed and blowing of blood from nose. Modalities: that is epistaxis is happening in the nose. Modalities: aggravation after sleep, mercury, quinine, summer and heat of sun, heat in general. Lachesis: snake. So snakes are aggravated to heat. Summer, they cannot tolerate summer. Same way, aggravation in lachesis patient is from summer and heat of sun, heat in general, aggravation. After sleep, mercury, quinine. Ameliorated by discharge and cold application. Let's summarize lachesis. We come from the top. First we'll deal about what does the lachesis do in the blood. It will decompose the blood, make it fluid and non-coagulable and it leads to bleeding. It is also in hemorrhage. What does it do? Inflammation, ecchymosis, gangrene, abscess, pyemic conditions, jaundice and everything. Then the bleeding will be profuse and it is also dark, watery, offensive and non-coagulable. First headache, then menses, skin, fever, nose. So in headache what you have to remember is The blood feels as if it is gone towards the head, and there is a congestive type of headache as if skull will burst. In the menses, it will be short and scanty, dark, watery, and non-coagulable blood. And they are relieved by menstrual flow. All the complaints are relieved by the menstrual flow. Skin, there is hemorrhagic bloody sweat, and it is given in ulcers, gangrene, pyemic, asthenic inflammations. The blood will be continuous and profuse, and the discharges will be offensive and ichorous. Fever, what did we learn? There is hemorrhage in the bowel. Why does it occur? Because of perforation in the intestine. Nosebleed and blowing of blood from the nose. Aggravated, summer, heat in general, sleep, mercury quinine. Ameliorated, discharge and cold application. See, amelioration, discharge. In the menses, troubles are relieved by menstrual flow. That is also discharge. Whenever there is a discharge, there is amelioration. And aggravation, summer, sleep, and heat in general, and lachesis. Hope lachesis is clear. Now we'll move on to crotalis. Ailments from sun, fright, alcohol, and vaccination. Ailment from vaccination, alcohol, sun, and fright. Sphere of action, fibrin of blood and liver. Where does crotalis act? It acts on fibrin of blood, liver, cerebrospinal nerve centers. That is, it also acts on the brain. It causes decomposition of blood and produces hemorrhage from all orifices of the body. Just as in lachesis, it acts on the blood, decomposes the blood and makes it fluid. Same way here also, it results in decomposition of a blood and hemorrhage from all orifices of the body. There is a hemorrhage from eyes, there is bleeding from eyes, ears, nose, mouth, throat, and urethra, and even pores of the skin will be bleeding in crotalis. Blood is fluid, dark, non-coagulable, offensive. Fluid, dark, non-coagulable, and offensive. Diathesis, hemorrhagic diathesis. As we are dealing about hemorrhagic remedies, it's obvious that the crotalis patient, it is indicated in hemorrhage, which means the people will be prone to bleeding. Hemorrhagic diathesis. Purpura hemorrhagica. Sudden bleeding from all orifice, skin, nails, gums. The bleeding apart from the eyes, ears, nose, there is also bleeding from the skin, nails, and the gums. Low septic condition with the blood decomposition. Abdomen, vomiting of blood, dark, coffee ground vomiting. How is the vomit? The vomit is also dark. It is coffee ground vomiting. In cancer of stomach, vomiting of blood, dark, coffee ground vomiting. Let us go to stool. Hemorrhage from the bowels, ulceration of bowels. Character of the stool will be black, thin, offensive, coffee ground. There is intestinal hemorrhage. Whenever there is a perforation in the intestine or any other pathology in the intestine, the hemorrhages occur and the bowels will be offensive and coffee ground in crotalis. You need to remember coffee ground appearance. Coffee ground in stool as well as vomiting is in crotalis. Blood oozes from rectum when standing or walking. The normal activity when the person is standing, he is walking, there is bleeding from the rectum. Character of the blood, again the blood which oozes out from the rectum will also be dark, fluid and non-coagulable. Liver, in malignant jaundice, hematic rather than hepatic. The jaundice is hematic rather than hepatic. Female genital organs. Crotalis in menses, it is suited to dysmenorrhea and a prolonged menorrhagia. There is prolonged menses. There is prolonged menses with copious dark liquid blood which oozes all the time. Here again the menses are dark and it is oozing out all the time. It is prolonged menses. Vicarious menstruation, nose bleed instead of menses. During hemorrhage, the skin becomes cold and dry. The patient wants fanning. Usually right side is affected. In lachesis, the left side was affected. In crotalis, right side is affected. Modalities: aggravation of lying on right side, open air, evening, morning, and after sleep. Ameliorated by rest and fanning. Like the patient wants fanning, which means it ameliorates his complaints. Let's revise again. Crotalis, sphere of action, blood and liver, cerebrospinal nerve centers. What does it do? It decomposes the blood and it causes hemorrhage from all orifices. And then fluid, the character of the blood will be dark, non-coagulable and offensive. It is given in purpura hemorrhagica. There is sudden bleeding also from the nails, skin and gums. Abdomen, there is coffee ground vomiting. In cancer of stomach, coffee ground vomiting. Stools, you need to remember there is ulceration of bowels and hemorrhage from bowels. The stool will be offensive, coffee ground. And again, when the person is standing or walking, there is a oozing of the blood from the rectum and crotalis. Liver, in malignant jaundice, it is given more in hemorrhagic jaundice, hematic jaundice rather than the hepatic jaundice. In the female genital organs, we read about the menses. It is suited to dysmenorrhagia and prolonged menorrhagia. How is the menses? They are prolonged. The character of the blood will be dark liquid blood. It oozes all the time. Vicarious menstruation from the nose, and the skin is cold and dry during hemorrhage, and the patient wants fanning. Amelioration by fanning and rest, aggravation by right side, and open air, evening, morning, and after sleep. So with this we come to an end of crotalis as